औज़ुबिल्लाहिमिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम अर्रहमान अल्लमल कुरान। आज काफ़ी दिनों के बाद आप लोगों से बात हो रही है। हमेशा की तरह बात शुरू करने से पहले आज की अहम बात। नॉलेज इज़ ऑफ नो वैल्यू अनटिल यू पुट इट इनटू प्रैक्टिस। याद रहे कि जो कुछ आप सीख रहे हैं, जो कुछ आप लोग पढ़ रहे हैं, उसका काम है कि आप उसको अपनी क्लिनिकल प्रैक्टिस एग्ज़ाम के अलावा क्लिनिकल प्रैक्टिस में भी, ये जो कुछ आप सीख रहे हैं, अगर कोई पेशेंट आपके पास आता है तो अगर आप नॉलेज उसके ऊपर अप्लाई नहीं करेंगे तो कोई फ़ायदा नहीं। आपने उस एंगल से पढ़ाई करनी है। आज हमारा सेकंड लास्ट टॉपिक है और ये टॉपिक है स्पास्टिक पैराप्लेजिया। इट्स अ कॉमन टॉपिक और ये एक अहम टॉपिक है। द कमांड आपको मिल सकती है कि एग्जामिन द लोअर लिम्स एंड रेलेवेंट और एग्जामिन गेट एंड रेलेवेंट. So, like all the short cases, introduction and consent, hand sanitization, and exposure, which should only be underwear. But remember, keep in consideration about the weather and the modesty of the child. Then after that, look for this general look, which is whether the child is sick or well looking. There's cyanosis or respiratory distress at rest. There's pallor or jaundice and diagnostic or dysmorphic features and nutritional status. Then start with the gait examination. Most child won't be able to walk. Then examine, but you have to ask the parents कि क्या बच्चा चल सकता है before starting your examination. Then after that you examine for the lower limbs for the fasciculations, bulk, wasting, tone, power, reflexes, and then planters and clonus of upper and lower limbs. Then examine the sensory level and look for the palpable bladder. Check for superficial reflexes. Examine spine for myelomeningocele, scar for spinal surgery or mass. Look for patulous anus and ask the examiner before doing it. Look for bed sores and look for BCG scar. This is the spinal surgery scar mark. These are the few pictures about the bed sores. Stage 1 where the redness of the skin, then there will be formation of blisters, then damage to the skin, and then stage 4 they are the tissue loss, which can lead to life-threatening infections. So BCG scar, you all may have seen it. Then I have made a hypothetical description. Assalamu alaikum sir or madam. I have just examined an 11 years old Raj who was conscious and cooperative during my examination. A sick looking undernourished child without obvious respiratory distress and cyanosis at rest. There is no pallor or jaundice and no diagnostic or dysmorphic features. The child was unable to walk, so was not able to assess gait. There is reduced bulk in lower limbs with hypertonia, power of 2 by 5, and exaggerated reflexes with upgoing planters. The sensory system is intact and there was no palpable bladder. The superficial reflexes were intact. The spine was normal, there was normal anus and no signs of bed sores and BCG scar was present. I want to complete my examination by taking blood pressure, height, weight, and plotting them on centile charts and doing the fundoscopy. So there are a few differentials you can make. My advice for you is that you should not make more than 3 to 5 differentials. 3 will be fine, less than 3 is little, more than 5 is too many. So the pons disease, as well spine, which can be tumor or abscess, there will be complete paralysis, the downgoing planters. So look with the lower motor type, neuron type lesions. Then there is a transverse myelitis in which there will be sharp sensitivity level present. So how you check the level of the lesion? So if there's a lesion is at the lumbosacral level, there will be flaccid paraplegia, upper limb will be spared. While in case of thoracic, there will be spastic paraplegia. It will be the signs of upper motor neuron lesions, and upper limb will be spared. While in lesions in case of C8 to T1, there will be upper motor neuron lesions in the lower limbs and lower motor neuron lesion in the upper limbs. And then above C8, there will be spastic quadriplegia. Remember the lesions below T10, there will be absent superficial reflexes. So something about the pons disease, you investigate by the X-ray spine, MRI spine, chest X-ray, Montu test, ESR and the quantiferon TB gold test, and the treatment is for you give ATT and the jacket for stabilization of the spine. Something about the spinal tumor, diagnosed by MRI spine, its treatment is surgical and chemo or radiation is given. So thank you very much for your listening, and this is basic guidelines about the child who presents to you or a short case of the spastic paraplegia or examination of the lower limbs. So this is the basic guidelines. The main aim is to give you a roadmap in which you can improve and add as many things as you can. But you have to do this thing in 4.5 to 5 minutes. So next week we next topic will be the last topic, and after that, I will be looking forward for your advices or your suggestions. So what to start next. So I pray that may Allah be our helper, protector, and guide. Allah Hafiz.